Hello everyone. Today we are going to talk about removable appliances. What is the definition of removable appliances? It is the term used to indicate an appliance which can be removed for cleaning by patient or for adjustment by orthodontist. What is the classification? Classification comprises of active, functional and passive. Active comprises of headgear, face mask, chin cups and lip bumper. Functional comprises of activator, bionator, frankers. Passive comprises of space maintainer, bite planes, retainers, posterior bite blocks. What are the advantages of removable appliances? It involves less chair side time, easily removed by patient for brushing and cleaning, and are aesthetically better. Limitations of removable appliances: only simple malocclusion can be corrected, difficulty in speech, and uncooperative patient can remove removable appliances anytime. Components of removable appliances: it comprises of active component, retentive component, and acrylic. Now, active component comprises of labial bow, spring and elastics. Retentive component comprises of C clasp, U clasp, Adams clasp, triangular clasp, Swartz clasp, south end clasp, Dysing's clasp, ball end clasp and delta clasp. Now, today we are going to talk about retentive component. What are retentive component? These are the unit of appliance which hold appliance in position and is called clasp. It gives good retention and it engages in the undercut for retention purpose. What is undercut? Undercut are the portion of tooth surface just below the height of contour. The types of undercuts are mesial distal, buccolingual and proximal. Now, what are clasps? Clasp can be defined as a component of removable orthodontic appliance that retains and stabilizes an orthodontic appliance in oral cavity by contacting the surface of the tooth or surrounding the tooth or by engaging in the interproximal embrasure. Now, what are types of clasp? Types of clasp are C clasp or third quarter clasp, full clasp or Jackson's clasp, triangular clasp, Adam's clasp, south end clasp, Dysing's clasp, Swartz clasp, eyelet clasp and delta clasp. The location of clasps are posterior region, mostly in the first permanent molar. Now, first clasp which we are going to talk about is C clasp or third quarter clasp. The armamentarium used are 0.8 mm SS wire, Young's loop forming plier, marking pencil and wire cutter. The construction of C clasp they are mostly used on premolars and molars, and it extends from interproximal embrasure of clasp either mesially or distally, passes below the maximum bulge area. Adjusted by holding it at the contact point, bending it towards the tooth. The drawbacks of C clasp are it cannot be used on deciduous teeth as there is no infrabulge area, cannot be used on partially or partially erupted teeth. They are used on the posterior teeth and difficult to adjust. Next clasp which we are going to talk about is full clasp or Jackson's clasp. The armamentarium used are 0.8 mm stainless steel wire, Young's loop forming plier, marking pencil and wire cutter. It is mostly used in premolar and molar region. The piece of wire is taken and adjusted from its center, adapted on the buccal surface of the tooth to lie below the non-bulger area and above the gingival margin. The wire is adapted across the buccoproximal line angle into the proximal embrasure and curving the contact point and occlusal embrasure or the lingual surface. It is adjusted by bending the clasp towards the tooth by holding it at the contact point. Drawbacks are it cannot be used on deciduous teeth, it cannot be used on partially erupted teeth and used only on the posterior teeth and difficult to adjust. The next clasp which we are going to talk about is Adam's clasp, or it is also known as arrowhead clasp, Liverpool clasp or universal clasp. It is the most commonly used clasp used on any tooth but generally used on molars and premolars. The parts of clasp are bridge, arrowhead and retentive arms. The two arrowhead engages the buccoproximal undercut area united by the bridge. The arrowhead continue as retentive curves on lingual surface or palatal surface. The armamentarium used are 0.7 mm stainless steel wire, Adams wire bending plier, Young's loop forming plier, wire cutter and marking pencil. The mesial distal undercut of molars are marked on cast. Distance between these marks form the length of bridge of Adams. 90-degree bend is made. Mesial distance undercut is marked on wire by placing on cast. The wire bent around to form the U, thus forming the arrowhead. Arrowhead is squeezed between two beaks of plier. The arrowhead is given 45-degree twist to form 45-degree angle to bridge. The outer arm of head is given 90-degree bend at the height that is half of arrowhead. Adams place on tooth and free end should rest across the embrasure. Mark is done on palatal side of contact area and palatal tag arm is given. When viewed from occlusal aspect, the bridge of Adams should be parallel to buccal surface of the tooth. On completion, the bridge of Adams should be at 45 degree to the long axis of tooth. When viewed from buccal aspect, the bridge should be parallel to the occlusal surface. Advantages are it can be made on any teeth in the arch, it can be made on deciduous or permanent teeth and on partially erupted tooth. Small clasps take up minimum space in the buccal surface. The modifications of Adams clasp are: first is Adams clasp with helix. The helix is added in the middle of the bridge portion of the Adams clasp and is useful for attachment of elastics. Adams with shouldered hook. Small hook shouldered onto the bridge portion of the clasp used for attachment of elastics. Adams with distal traction hood. Distal end of bridge is modified to incorporate a traction hook for attachment of elastics. Adams with additional arrowhead. Additional arrowhead is made for premolar and is shouldered to the bridge portion of Adams clasp on molar for additional retention. Adams with single arrowhead. Only one arrowhead is fabricated to engage a partially erupted tooth and other end is adapted like circumferential clasp. Adams clasp with shouldered buccal tube. Buccal tube shouldered on the bridge of Adams clasp for attachment of face bow. Double clasp or Adams clasp on maxillary central incisor. Bridge of the clasp runs across the two incisors and the arrowhead engages the distal buccal undercut of two central incisors.
Now let's learn about the Schwarz clasp. What are the armamentarium? We require 21 gauge stainless steel wire for it. Now what are the parts of it? There are basically three parts, that is the arrowhead, vestibular portion and the retentive arm. Now let's see about the construction, that is how we basically make a Schwarz clasp. First, using the arrowhead clasp forming plier, an arrowhead is made. Then the head portion of the arrowhead is bent gingivally towards the undercut below the contact point of two teeth. Vestibular portion is made in a way that it stands away from the soft tissue and its vertical extension should be within the limit of attached gingiva. Now the clasp can be made to engage the posterior teeth. The anterior arm of the clasp crosses over the mesial contact point of premolar on palatal or lingual surface, while the posterior arm runs distal to the last erupted tooth and ends on the palatal or lingual aspect of the cast. Now what are the advantages? It allows partially erupted tooth to erupt in its normal position, and it can also be used in both the dentition. Arrowhead can also be easily adjusted, and when the bite block is given, it does not interfere with supra-eruption. Now let's learn about limitations. It is actually very time consuming and usually it is used only for posterior teeth. We do not prefer it in anterior teeth. Also it requires skills and special pliers. Now the next one we will learn about is south end clasp. What are the basic armamentarium? We require a 21 gauge stainless steel wire for it. Now let's learn about the construction. A V-shaped bend of 6 inches of the 21 gauge stainless steel wire is first made and then it is adapted on the maxillary central incisor following the contour of the interdental papilla and along cervical margin. on either side and 1 mm away from the gingival margin. Now pass the wire across the distolabial line angle and over contact point of the palatal surface. Then adapt a retentive arm and provide relief for flow of the acrylic resin. Now how do we adjust it? We can readapt it by into the interdental area. Now, what are the advantages? Now it has a simple design and provide good aesthetic. That is why it is usually preferred in the anterior region. Also it is less obtrusive. It comes with a few limitations like it is difficult to fabricate and also irritates the soft tissue. Now let's continue with the next one, that is miscellaneous clasp. It has usually two clasps in it, that is the first one is dicing clasp and the second one is the eyelet clasp. First let's learn about the dicing clasp. Basic armamentarium what we use is 21 gauge stainless steel wire. Now first let's learn about the construction. This clasp is constructed into the two halves. If situation demands, only one half of the clasp can also be constructed. The clasp is used to engage the buccal undercuts of the molar. It also comes with now certain advantages and limitations. Now let's first see what are the advantages of it. First, it does not irritate the gingiva. Possible to use only one half of the clasp and one half can be made to extend fully to anterior or posterior part of the tooth. Now, what about the limitations? First, it provides limited retention and accumulation of the foot debris is also more in this case. The second one is now eyelet clasp. Basic armamentarium is the same. We will be using 21 gauge stainless steel wire. Now construction. The clasp can be constructed as a single eyelet clasp or a continuous eyelet clasp. It is then fabricated using Young's loop forming plier. Eyelets are placed in the embrasure. Now 3 or 4 eyelets are made depending upon the retention requirement because single eyelet clasp does not provide much retention. Now let's see the advantages. First, it is less likely to break and it also does not interfere with the eruption of the teeth. Its limitation includes that it is hard to adjust and easily set out. It occupies more space and also it makes distance between the teeth. Now the next one what we will study about is delta clasp. Basic armamentarium is the same. We will be using 21 gauge stainless steel wire for it. Now let's see the construction. The clasp is constructed in similar manner as that of the Adams clasp, which has already been showcased. Now the width of the bridge is determined and then the retentive loops are constructed. The retentive loops are shaped as a triangle that resembles a delta. If teeth are not fully erupted or the undercuts area are not favorably shaped, then the retentive tags are directed at right angle to the bridge of the clasp. Now they gain retention by engaging the interdental undercuts. Now let's see the advantages. It maintains better shape and requires less adjustment. Also it is less prone to breakages. Now the limitation includes that it needs special plier and is also difficult to fabricate. The next one what we will be learning about is a triangular clasp. It is called so because it requires the shape of the triangle. Now armamentarium is 21 gauge stainless steel wire. What are the parts of it? First, it's the base of the triangle that is away from the embrasure. Then comes the apex of the triangle which faces embrasure. Next, the retentive arm and the retentive tag. Now what are the uses of it? It is used as accessory clasp and also to provide additional retention. It comes with certain advantages and limitations. First, let's learn about the advantages. It do not interfere with the maintenance of the oral hygiene and it is easy to fabricate. It engages into proximal undercut between the two adjacent teeth. Now limitations, it cannot provide adequate retention when used alone. Now let's see about the next class, that is crozet clasp. Armamentarium is the same, that is 21 gauge stainless steel wire. Now the parts, it has two parts. First one is the circumferential arm and next one are the retentive arm and tags. Now uses, it is used as retentive component for active removable orthodontic appliances. Now it has certain advantages and limitations. Now let's see about the advantages first. It is easy to fabricate and offers better retention than the full clasp. Limitations, it requires a soldering machine for soldering the additional piece of the wire at the base of the circumferential arm of the crozet clasp. So now we are done with all the clasp.